I'm Deanna Palm, president of the Hillsboro Chamber. Thank you all for joining us here today. Very special presentation from Washington County here this morning. Very excited to hear from Marni Kuyl, who is the Director of Health and Human Services for Washington County, and probably one of the most busy people we might have known over these past few months. And I just want to take a moment and thank you, Marni, for your leadership. I have heard wonderful things about the work that you're doing under the most difficult circumstances. So we really thank you and appreciate the fact that you've been at the helm of these really important decisions that have been made for Washington County. So with that, I'm going to turn it over to you and welcome you. Thank you.
Great. Thanks, Deanna. It's been really honestly a team effort and community-wide team effort. And I was talking to you earlier that I know I and my public health colleagues, we feel pretty lucky to be in Washington County because certainly people are disappointed by some aspects of this and scared and hurting a lot because of this pandemic, but in general, they're supportive of the public health community and public health recommendations. So we feel pretty lucky to be here. So I'll get started. My plan today is to just sort of ground everybody a little bit in the latest data. Just give you a little hint about some of what we're doing to try and support small businesses because we know small businesses are really suffering in this pandemic. And then Deanna really asked me to focus on the vaccine program. So that's the plan for today. I'm happy to take questions. I don't know what your typical process, if you raise your hands or if you put things in the chat, but between Deanna and whoever, just shout out at me if I'm missing a question. So we can go to the next slide. So just to kind of ground everybody, I like to typically start with the Oregon. These are the statewide numbers. And we waited until late yesterday to try to get you yesterday's numbers, but they didn't come in until pretty late in the evening. So as of the 15th of December, Oregon had a cumulative number, 96,092 cases, so just under 97,000 cases. Our statewide case rate is 2268. So a case rate is basically the number of cases per 100,000 population. We use a case rate because it helps to compare over time and it helps to compare across different communities. So we typically, whenever you hear case rate, that's the number of cases per 100,000 of population. In Oregon, unfortunately, we've had over 1,200 deaths, and we are continuing to see an increase in hospitalizations. Our 2-week average of hospitalizations is 388 people per week. That's the average over the past 2 weeks. So next slide. We'll see Washington County specific numbers. So these numbers are up to date as of the 14th of December. We had a total of 13,273 cumulative cases in Washington County. As a reminder, February 28th was the first case reported in Oregon, and it was a Washington County resident. So we were unfortunate enough to have the first case. And it was really unfortunate for me because it was my birthday. So I don't think I'll ever forget that birthday. And it was a big birthday. We have had also, we count presumptive cases. So a presumptive case is somebody who has the symptoms, had close contact with somebody that's COVID positive, and they don't have a positive test result yet. So from a public health perspective, we treat those exactly like we treat positives. And we either take them out of the presumptive count and move them into confirmed or into negative once they have had a test result. The hospitalization number that you're seeing is cumulative since February, as are the deaths that you're seeing. So a little bit, if we scroll down a little bit, the numbers at the bottom are outbreaks that we are dealing with the week of the 14th. So we have 44 outbreaks in long-term care congregate setting or long-term care settings. So those are like nursing home and assisted living centers. We have 9 additional outbreaks at other congregate settings, 10 workplace outbreaks that we're working on, and 7 daycare camp school-related settings that we are working with outbreaks. An outbreak is defined as 5 or more related cases at a facility. So we can go to the next slide. So this is just another way of looking at the data. I'll scroll down just a little bit more, but this is what we call an epidemiologic or an epi curve. And it just helps you to see over time what's been happening with our cases. So you can see from February through to the current week. And you can see that we've had really beginning in late October, a significant increase in cases. And we did see that Thanksgiving bump that we expected. So we'll see that in a couple minutes. So we can go to the next slide. So just as a reminder about the public health risk indicators that the governor announced a couple of weeks ago. So this is what we like about these indicators is they really help to describe risk based on that case rate that I talked about earlier. It's easier to understand. It's also consistent with the case rate they're using to help judge when it's safe to reopen schools to in-person learning. And so what you can see is a continuum. So from extreme risk or extreme spread of 200 cases per 100,000 or higher, down to minimal spread with fewer than 50 cases per 100,000. That middle row is really for smaller counties. So smaller counties, they base risk on the number of cases. So they're not using a case rate because maybe they don't even have 100,000 in that county. And then the other thing that we look at is percentage of test positivity. And the state of Oregon uses the same test positivity methodology as the CDC now. So that was a good change that they made. So what we're counting is the number of positive tests over all tests done. In the past, we were looking at number of positive people compared to all tests done. This is more accurate, and it's also more comparable across counties and across states because it's similar to what the CDC and actually the World Health Organization use. So that was a good change. So we can go down a little bit so you can see where is Washington County and where is the region. So you can see this is kind of the bad news that I bring today. Washington County, our case rate is still very high. The week ending on December 5th, our case rate was 515 per 100,000. I did see that the following week it did go down slightly to 486 per 100,000. So that's good news. Let's hope that continues. In order to move down into a lower risk category, so to move from extreme risk to high risk, we need to be at the lower under 200 cases per 100,000 for 3 weeks. So I guess this is the bad news part of my presentation is that we're likely to be in this extreme risk category well into the first of the year, well into January. The other thing that you'll see is our case rate, our test positivity was 8.4. And you'll see that the rest of the counties in our region are also continue to be in that extreme risk category. So we can go to the next slide. Okay, so I just wanted to review a little bit because I think that you are all very well aware that Washington County did receive direct coronavirus relief funds, and a lot of that funding was really used to support our public health response. So case investigation, contact tracing, a lot of isolation and quarantine. For example, we have 244 new families just last week that we had to provide isolation and quarantine support to. So that means helping them obtain food, pay their rent, their utilities, childcare. Sometimes it means putting a family member into a hotel because they don't have the ability to isolate appropriate. So, a lot of the funding did go to support that public health response activity, but we also have distributed over $20 million in coronavirus relief funds to local businesses through MISO and the business recovery centers. $10 million has gone to school districts and childcare centers. The effort there is to really support childcare centers to reopen and schools to provide learning support so that parents really can get back into the workforce. And so that's what's been going on with the school districts. We recently provided $1.8 million to restaurants and the hospitality industry. And then we've also provided ongoing technical support and guidance to businesses. We have different specialists that have been assigned to specific sectors, whether it's restaurant sector, indoor play structures, those kind of things. So that's just a little summary of what we've been doing to try and support small businesses. We can go to the next slide, get into the meat of what you've asked for. So vaccination update, I just wanted to provide some general vaccine information and share some of the challenges, some of the safety and effectiveness of the vaccine. What is the data telling us? Timelines and the phased priorities, and just talk a little bit about what is the impact to businesses as we roll out vaccinations. So we can go to the next slide. Next slide, sorry. Okay, so vaccine challenges. This is probably not something new to you. If you turn on any electronic device, whether it's a television or your phone or computer, you're going to be hearing about vaccines and vaccination. One of the challenges with the Pfizer vaccine in particular is the temperature control needs. It has to be stored at ultra cold, so minus 70 degrees Celsius. So what that means really logistically is that we can't just send it to every pharmacy, every nursing home, every doctor's office, because they don't have the ability to store it in that way. And so these first doses have to go to really large health systems. There's others like Clean Water Services has this kind of freezer. We have to be really careful about where the vaccine is distributed. And each different vaccine needs to be stored at a different temperature. So people receiving the vaccine are going to have to be really careful, because if you store the Moderna vaccine, when it becomes available at that ultra cold, you'll ruin the vaccine. So people are going to just have to pay attention. The other big challenge is that we have to, that there's 2 doses of vaccine required from different, for both vaccines, and they have different intervals, and you have to receive the same vaccine. So if you receive Pfizer vaccine as your first dose, you have to receive Pfizer vaccine as your second dose. And then Deanna and others were talking a little bit about, I wish people would stop saying what the side effects are, but we want it to be both reassuring, and we want people to know what to expect so that they're not surprised when they do have that sore arm. Sometimes people complained of headache, achy muscles, low grade temperature, or fever. And so, helping people to manage that and expect that and manage it and be prepared for it is really important. So it looks like there's a question: what happens if the temperature controls aren't held? So if the temperature controls, and there's time limits. So obviously, like with the Pfizer vaccine, you don't put it in somebody's arm at negative 70 degrees Celsius. So once it's thawed, you have 6 hours to use it. And so that will be a logistical challenge as we're setting up vaccine clinics. And you can watch the hospitals as they're doing this now. You bring out just a small amount of vaccine as you're using it. It doesn't take long to thaw, but if it's not maintained at the appropriate temperature, then it becomes ineffective. Okay, about the vaccines, we can scroll down. So just a little bit. So Pfizer vaccine was approved by the FDA on the 10th of December, and the Academy of Immunization Practices recommended the vaccine Sunday, and so you saw that it began being shipped on Monday. So the Pfizer vaccine is approved. Moderna vaccine, we expect FDA approval today or tomorrow. And then the Academy of Immunization Practices will likely review it this weekend or Monday, like they did Pfizer. So these are really the two vaccines that are being pushed out quickest, and the ones that we know how many doses we're getting when. So we'll go through that. So Pfizer vaccine does require 2 doses, and it's 3 weeks apart, 21 days apart, as compared to Moderna, which also requires 2 doses, but it's 4 weeks apart. And then they're both, the data is showing both of them are 95% effective. I was looking at confidence intervals, and they're really good. It looks like it's between 92 and 97% effective for both vaccines. So I think we can say with a lot of confidence that these vaccines prevent severe symptomatic COVID infection. We talked about that the Pfizer vaccine has to be stored in this ultra cold storage. Moderna is frozen normal, like your normal home freezer. And I just talked about emergency approval of Pfizer. And the other thing I'll just emphasize again, if you get Pfizer vaccine the first time, you have to get Pfizer vaccine for your second dose. You can't mix doses because there was no studies done, and so we don't know what the effectiveness would be if you mix doses. One of the questions that I typically get is, well, what if you only get 1 dose? What's the effectiveness? And the effectiveness with 1 dose has ranged in the 50 to 60% range. So it provides some protection, but to get to that 95 to 97% effectiveness range, you need to get both doses. We can go to the next slide. So common side effects we talked about. Sorry, I guess I'm overstressing this. And you know what I would say about these common side effects is almost every vaccine that we get, whether it's tetanus, so not everybody on this call, but some of us on this call are at that age where we're getting the shingles vaccinations. So these are really, really common, and in some ways it's good news. It means your immune system is kicking in and doing its job. So when I get these side effects, I usually think, okay, good, my immune system is working and doing what it's supposed to be doing. One piece that that actually has come out is that the Immunization Practice Committee is watching is in Great Britain. So there has been 4 incidents of severe allergic reaction from the Pfizer vaccine. And so they're still watching, and they may make a change in recommendation for people who carry EpiPens because they have serious allergic reactions. So nobody has died from these serious allergic reactions because they can be altered with the EpiPen, with the epinephrine injection. But it is something that the Academy of Immunization Practices is watching. And if somebody is known to have severe allergic reactions to things like bee stings or medications or other vaccines, then they would likely have you stay longer just to make sure that there's no allergic reaction. Other than that, there really has been no serious adverse reactions during the clinical trials for either vaccine. So we can go to the next slide, a little bit more on safety.
Marni, somebody asked about the age range.
Oh, okay, thanks. That's a great question. So the Academy of Immunization Practices made a recommendation for 16 and over. So that is a really important question because one of the questions we get is, will these vaccines be required for school kids? And the answer right now is no, it's not recommended for anybody under 16. So there'll be no kids getting the vaccine at this point. And it will not be a requirement for school-aged kids. So thank you for asking, and it's 16 and above is the recommendation. So the reason I put this in is because some people have been concerned about the vaccine safety and efficacy because it feels like it came about really quickly. So a couple of things about that. One is coronavirus is a family of viruses that cause a lot of different, just the common cold is typically caused by a different coronavirus, not coronavirus 19, the SARS virus that we're worried about. I don't know if you remember about 10 years ago when we were all concerned about SARS. So people have been working on a coronavirus vaccine for decades. And so just to know that, and then as this coronavirus came about and we learned that it really was so deadly, it's had a much higher mortality rate than any other coronavirus or influenza. And so then they really started doubling down on the vaccine research. And these vaccines did go through the same clinical trials that other vaccines go through. So they went through 3 phases of clinical trial. The highest rigor of clinical trials is the placebo-controlled double-blinded study. So meaning you don't know which vaccine, whether you got a placebo or whether you got the actual vaccine. And double-blinded means that the person that's giving it to you also doesn't know. And so when they're looking at the data, they can really look at, was there differences between people that receive placebo and people that receive the vaccine? So both when they're looking at effectiveness and safety of the vaccines. So we also, have had many oversight. The Data Safety Monitoring Board looks at the data first. The FDA looks at the data. The Vaccine Related Biologic Products Advisory Committee is part of the FDA. The Advisory Committee on Immunization Practices that I've talked about. And then the 3 Western states have an actual extra layer, the Western States Scientific Safety Review Committee. And so there has been a lot of scientific review and feel that these vaccines are really safe. So we can go to the next slide. So these are the preliminary preliminary allocations of vaccine that we've been told that we will get. We did receive that initial vaccine allotment, and we expect to receive the allotments of Pfizer and Moderna on the 22nd and the 29th. I think it'll really start ramping up during the first of the year. We can go to the next slide. Just to let you know, we do hope that we'll move into, this is the phased approach. So because there's limited doses, the first vaccine is going to paid and unpaid people who work in healthcare settings, who have the potential for direct exposure to patients who have COVID. And within the hospitals, they're even limiting it more because they're getting such small, limited doses in this first shipment. And remember, we have to assure that there's enough doses that they get both doses, the first and the second dose. During phase 1B, it will expand to other essential workers. And I will tell you that the CDC and OHA are still trying to clarify what is an other essential worker. There's some that we know it'll go broader into more healthcare settings, people that work in assisted living, nursing homes, our emergency, EMS, fire partners, law enforcement, teachers maybe in this other essential workers, IT infrastructure. So this is really getting broader in the phase 1B. And people over 65 or who have high risk of coronavirus, severe outcomes, hospitalization, and death. So we can go to the next slide. So just to give you a little bit of a reality around, you saw those doses that we're getting, which is fewer than 300,000 in that first in December. Healthcare workers alone, we have over 300,000, and long-term care workers and patients or residents, there's over 100,000 in Oregon. So it's, I put this slide in because I think one of the things we're all going to have to be is patient, waiting for our turn, because these are the 1A, and you can see that we're short vaccine just to cover them. So we'll go to the next slide. There is hope, though, that by January, we'll be moving into the 1B, and by late spring, so April, May timeframe, we'll move into these phase 1 and phase 3. So phase 2 and phase 3. So phase 2 is just really expanding the remainder of the phase 1 population. So everyone that works in a healthcare setting will be vaccinated. Everyone that works in a long-term care facility, congregate setting, group homes, those kind of settings. And then critical populations and general population will begin in phase 2 and continue through phase 3. By the time we get into phase 3, the hope is that there will be enough vaccine by late spring for every Oregonian that wants to have a vaccine. So when we're in phase 1, the vaccine is really being distributed to health systems, for health systems. For assisted living and nursing homes, there is contracts with large pharmacies who are receiving the vaccine because they can store it appropriately, and they're providing the vaccine at no cost to the assisted living nursing homes. As we move into phase 2, and we can actually move, I think the next slide shows this really well. Yeah, so as we move through the phases, so you can see in that first phase, I know this looks like Swiss cheese. I don't know who at CDC thought this was a great graphic, but it's kind of the best one we have. But in the beginning, like I said, it's hospitals, frontline staff, and so it's really limited on where the vaccine is distributed. And then we'll move to long-term care and the general as we move into the general population. So we'll have all sorts of partners in pharmacies, healthcare providers, our EMS. So we're working with Metro West and TVFNR to have them be able to help us provide vaccinations. Public health will be really focused on the medically underserved, people that have difficulty accessing, so homebound people in group homes, those kind of things. So that's sort of how the vaccine will be distributed. So it'll be broader and broader. Most of us are going to get our vaccine through our healthcare provider, through our doctor's office, or through a pharmacy like we do our influenza vaccination. The next slide. So the county's role is going to be really focused on making sure that the high risk and disadvantaged populations have access to vaccine as the vaccine becomes widely available. So we'll be just like we do now with influenza vaccine and with COVID-19 testing, working with our federally qualified health centers, working with our community-based organizations to set up vaccine clinics. So like Virginia Garcia Neighborhood Health Center, Centro Cultural, Families en Ascensión, potentially with, many of you all. So really focused on people that don't have access to healthcare, pharmacies, people living in poverty, people that are homebound, aging population, working with home healthcare organizations, those kind of things. Next slide. Our other focus is really coordination with state, regional, and local partners, city and county emergency managers, looking at what are some ideal dispensing locations. How do we make sure that there's geographic access across our county? And then, like we've done with COVID testing and influenza vaccination, working with the health systems to provide large drive-through vaccination operations. And this is as it becomes available to the larger public. Next slide. So community engagement, a couple of things are happening. Oregon Health, because we have a big group of people that are really anxious and I want to be first in line and when can I get my vaccination? We also have groups of people that are just anti-vaccine, and we have groups of people that don't trust the vaccine. It may be because of historical mistrust of government, especially in our BIPOC community, when you think about things like the Tuskegee experiments and experiments that have happened on our Black, Indigenous, and in this area, our Latinx or our Asian community. And so Oregon Health Authority is helping to pull together an advisory committee to help us think of, because we know our Black, Indigenous in Washington County, our Latinx population have been disproportionately impacted by COVID-19, whether you look at case rates, or you look at hospitalizations or economic impact. It has impacted our BIPOC community disproportionately. And so how do we ensure that they have access to the vaccine, that they feel confident and safe taking the vaccine? So they're going to be pulling together this advisory committee. They're also doing some surveying, and Washington County is also doing the same at a local level so that we understand what are the concerns, fears, and needs of our community within Washington County. The next slide. So shifting a little bit to how will this impact businesses and reopening, because I've been getting quite a few questions about will my business be required to show proof of vaccination, or employees, or will customers be required? And the answer to that is no. Business reopening is tied to case rates and test positivity. So it's that slide at the very beginning that shows the risk categories. And I'm sure that many of you have seen the different, the matrix of activity that's allowed during different risk categories. And so reopening is not tied to this vaccination. But what I would say is that the vaccination, as more and more of our community is vaccinated, that will have an impact on our case rate and our test positivity. That is what will bring it down pretty rapidly once we reach that 70% of what we call community immunity. But as I think that I've pointed out a lot, is that will take time because this vaccine is coming in slowly over time. I think it will grow exponentially as they're able to manufacture larger and larger amounts and get it distributed. In the meantime, we are still going to have to follow the activity guidelines, wearing our mask, hand washing, and the physical distancing recommendations. So we're going to have to hold with that for a few more months. So I think you hear us stressing a lot physical distancing and really being thoughtful about who you're gathering with over the holidays, and our concern about the Thanksgiving Day bump. And so I wanted to show you, we have seen now that we did have a bump. Even though this seems really big, it's not as big as some of us anticipated. So that was the good news. But if you look at the data and compare 2 weeks before Thanksgiving to 2 weeks after Thanksgiving, there were 56% more cases 2 weeks after Thanksgiving. And we use that 2 week time frame because that's the incubation period. That's the long end of the incubation period at 7 to 14 days. We can go to the next slide. Just reminders, we are still asking folks to really, over the holidays, to only share meal and household gathering with immediate household, and encouraging virtual connection with extended family and friends. The governor's orders really limit social gatherings to no more than 6 people from no more than 2 households. We are encouraging people, if you're not inside your house with your household, that you should wear your mask, and asking people to avoid crowded malls. And that, I think, is it, and happy to take any other questions or thoughts.
Marni, thank you so much. I think I'm going to stop sharing so I can see who's asking questions. And I would just ask for you to either raise your hand physically or virtually if you have a question. All right. Ada.
Good morning. Thank you. I put the question in the chat, but I don't think you saw it. One of the things I've heard before that might be helpful, because people are so fearful of side effects, if people started saying response or a normal reaction rather than side effects, would that help to create less fear for people, so they're more able to accept the idea that, oh, okay, this is a normal thing that should happen, and that's okay.
Yeah.
I mean, those are one of the fears that people have, is as a side effect. Side effects are usually noted as negative. So having it as a response would be less, cause less fear. The same thing with social distancing. Why don't we say more of physical distancing?
Yeah.
People get it.
Yeah.
Yeah.
No, those are great comments. Yeah, I think, it's interesting because different audiences have different needs. And so we're always trying to think about that. We have tried really hard to shift from social distancing to physical distancing, but that that social distancing word got out there early in February and March, and it's like nearly impossible to get, especially the national media, to change that. But hopefully today I used physical distancing. We're trying really hard to use that terminology because social connection is extremely important. And the longer this has gone on, the more important it is, especially for our homebound and our elderly, residents, family members. So thank you for that.
Thank
And
you.
I do see several questions in the, do you want me to go through some of the questions that were in chat real quick, Deanna?
That would be great. I think somebody asked a question. I think it was Kathy about the number of vaccines and wanted that slide. Is this the slide you wanted, Kathy?
Yes, that would be great.
Perfect.
Yeah,
Okay, well, we can share it with all of our attendees if that's okay.
Yeah, and I'm happy to, you could share the slides with everybody. The other thing is, and I don't have it right off the top of my head, but I can send it to Deanna to share. OHA has a great website that they're updating right now daily about the vaccine. So I think that's a great place to keep up to date, because we're just linking to their page because that's just the quickest and easiest way to get information about, the latest number of doses, what's been approved, who's getting it. So they've done a good job with their webpage. So I'll send that out to Deanna and she can share it. So I got one question about what about infants and do they need to get it? Kids, the vaccine, the Pfizer vaccine was only recommended for those 16 and older. And we'll see about Moderna. I think it will be the same age group, or it could be 18 and older, depending on how many were in their clinical trials. And then let's see. How do essential workers get in line for the vaccine in phase 1B? That's a really great question, and we've been thinking about that. So it's the answer right now is it kind of depends. Everybody's working on their final plans, and CDC and OHA are finalizing, well, who is an essential worker? So it's likely that for essential workers, you'll get in line through your work or be told where to go through work, because it's going to be, for example, if you're law enforcement, or if you're working for EMS or congregate settings, so working for group homes, those kind of things, that's going to be the first sort of layer of essential workers. And then it's going to go down to people that are teachers or that keep our utilities up and running. So it's just going to sort of be this relatively slow crawl of who's an essential worker. And so actually, the larger businesses, the health systems, the pharmacies, and public health are all in planning right now about how do we message that? How do we get out information? How do we message it? And it's going to depend on a lot of partnership with different sectors of our community as the vaccine becomes available for different population groups or critical workers. So I don't know if that answers it. It's sort of a we're still figuring it out answer.
So I see Tom has his hand up. So Tom, would you like to unmute and ask your question, and then we'll go back to the chat.
Yeah, I have two questions. A quick one is if you're a 1B due to age, how will you be notified? And my second question, which was kind of disturbing to hear the other day, that people in the news media thought they were essential workers. I can't believe that they would even ask that.
Yeah, it's been interesting. I've gotten a lot of emails from different people, both inside of the organization and outside of the organization, saying, well, my staff or my group is essential workers. And it's hard because I think it's going to really be based on, in the beginning, potential for exposure. Do you have to be at your job, and is your job potentially exposing you to other people. So that's kind of how the process that CDC and OHA and those of us locally are looking at to prioritize. If somebody can telecommute and work from home all day, every day, they're not exposed to other people. We don't need them to come in to fix the, gas lines, then maybe they're not essential, even though their work might be really important. So that's the line we're trying to draw. So your other question was about over 65 or people with chronic health conditions. And as enough vaccine becomes available to get to that 1B and phase 2 group, you will be hearing, I think you're going to hear it all over the place, where we have plans for social media, regular media, newspaper, doctors' offices, and a lot of doctors' offices are getting really good about pushing out communication to their patients now, pharmacies. So we're going to do our best to get that information out as it becomes available for those over 65 or with chronic medical conditions.
Okay, a question in the chat. As a business owner, are there any particular considerations I should think of around vaccines? I don't plan requiring anything for employees, for example. What are the issues around this I may not have thought of?
That's a great question. I think, most people are going down the path of not requiring this and just really encouraging vaccines. I think one of the struggles we're going to have as we're vaccinating is that we are still going to ask people to wear their masks. And so I think that's going to be one of the struggles, even if your employee has been vaccinated, until those case rates really come down and there's herd immunity across our community. And we're such a global community that that's really hard to define. But until those case rates go down, employees, visitors are going to be asked to continue to wear masks. And I think that's going to be a really hard message that we're going to need a lot of help with, because people are going to say, well, I didn't get my vaccine because of whatever. I have a medical condition. I'm fearful. I just don't believe it, and whatever reason. But everybody else in this office did, so why do I need to wear my mask? And we're all going to have to kind of work through those questions because of community immunity.
All right. So if a business has essential workers, would someone actually contact them?
So again, I think we're working through the communication process. I think we're going to really, as essential workers are better defined, we're going to have to get out information. And certain sectors will certainly be notified, and it's really simple. Where it gets a little bit more difficult is when I'll just use the county as an example. So because we're working through this, we have some staff that are essential workers. For example, if you work in the jail, you're an essential worker. We have to staff the jail, and you can't not be around people and high risk people. So they're essential workers, but a lot of people, including some of my case investigators and contact tracers, are not essential workers. Their work is really important and we need them, but they can do it through telecommute. So we're working through that. I think that's when the communication is going to get really difficult, because there's going to be some businesses that have some people that are essential workers. Maybe they have to staff a front desk. That's an essential worker. But there might be other people that can protect themselves in different ways. So honestly, that's when it's going to get difficult. And so we're going to have to really communicate a lot using a lot of different strategies.
Next question from Sherry. When would we reach out to OHA for phase lineup for a company that is essential to patients but does not work direct with patients?
So there's already definitions that include, so for example, utility companies are defined, teachers are defined, people that are manufacturing supplies. So it's sort of similar to if you go back to the very first shutdown, stay home, save lives. The way that we defined essential workers was similar. So food workers, manufacturing, utilities. So it's pretty broad. I think that a couple things, you can go to the OHA website. We have, and I'll send this out to you, Deanna, but I think people have access to it, but we have our EOC business support email and phone number that folks could call and talk with one of the environmental health experts on this that are really specific to different sectors. So hopefully there's a lot of different ways that people can get that answer as it becomes more clear.
Thank you. All right, we have a question from Jamie. When numbers of vaccines shipped/received, is it a reference to the number of doses or the number of people who will be vaccinated, meaning the 2 doses?
Yeah, that's a great question. So the vaccine that's being shipped is the number of doses. So that's what we're referencing. And the second shipment will be used for the second dose, but eventually we'll catch up with that and we'll have enough vaccine that we don't have to be that careful and specific about. That second shipment is going to go to the same place that the first shipment went to because we have to assure those second doses.
I heard this morning that the vials that they were in, they were planned for like 3 doses each vial, but they're actually in some instances able to do 4 or 5, and that was
Yeah.
a big change, and that they were actually setting it aside, and that I guess the manufacturer said, no, you can use that, and so it increased the actual number of doses that are out there quite quickly.
Yeah, I saw that too on the news last night that I haven't read anything official from CDC or the Academy of Immunization Practices yet, but I did hear that on the news. And I'm not horribly surprised because back in my day when I was a real nurse doing vaccinations, it was not uncommon to have extra doses in a vial. And I was thinking, well, it's good that there's a lot of pharmacies that are finding this because of course your first thought is, oh, did I do something wrong? Like, did I short somebody?
Right.
But it sounds like it's been a pretty consistent finding. So it'll be interesting to see. That would be a good thing, but it's not uncommon.
Just a comment from Heidi, who says, we business owners can be public health partners for sure, helping get out the messaging and support the effort. So yeah, absolutely. Utilize business organizations, and we'll send the message out to our members who will then send it out to their network. So, absolutely willing to help and support.
Great, thank you. We'll need a lot of help getting, this is going to be complex communication, so.
So I have a question about as we move on this, the trajectory right now, we're obviously in extreme, and then the next one is below it.
High risk, yeah.
High risk. Are we staying tethered to the Tri-County area?
We're not tethered to the Tri-County area anymore with this new risk category, but we're kind of staying. The numbers are kind of staying consistent, but we're not. If we went below to the high risk if we went below the 200 cases per 100,000 for the 3 weeks, we could go down to the high risk or moderate without the other 2 counties.
Great. Okay, that's really good information.
Yeah.
Any other questions from our participants? Because I have a couple others. Is there any other thing in the chat that I'm?
Yeah, it looks like there was one about a wife. My wife is a chiropractor, close contact. How do we ensure she's included in consideration? So she would be considered likely in 1B when they get below the 1A, which is really healthcare providers in a hospital providing services to COVID patients. But once you get broader healthcare communities, chiropractors, pharmacists, EMTs, the really brought up people that do janitorial services and health systems, doctors' offices, all of them will be considered. Dentists will be considered in the 1B.
Will childcare providers also be in some sense of essential worker?
Yeah, teachers and childcare providers, and right now teachers seem to be sort of in the middle between 1B and phase 2. So we're still not sure whether they're going to be 1B or phase 2, and I think it really will depend on the amount of vaccine that's available. But everybody's goal is to get our kids back in school.
So I guess another question is about, those of us folks that do events and activities and things like that, as we're planning, and business loves certainty. So as we're planning next year, you're talking about late spring to get to around that 70%. So what does the fall look like in Washington County?
Yeah. Well, that's a great question to get my crystal ball out. So I think, what we've been reassured is that there will be enough vaccine for everybody in Oregon that wants vaccine in late spring. So I think that's in the May timeframe. I think what the crystal ball needs is, will Oregonians, will Washington County residents take the vaccine? If we have a high percentage of people that don't become vaccinated, then we'll continue to see spread and high case rates, and the fall will look like it looks now. Hopefully not quite as bad. If we can reach that community or herd immunity of 70%, we'll see cases drop pretty quickly. And I think that we'll get to a baseline where it's more like influenza. The other thing that we don't know, because these clinical trials were the first clinical trials for this particular vaccine, is this something that we're going to need to get a new vaccine in a year, in 5 years? And so there's still a lot. This is a novel coronavirus, so there's still a lot to learn over time about how long the immunity will last. So I'm sorry, I don't have it. My crystal ball is really foggy.
Well, I have to just say though, and once the vaccine, came out, and it gives us hope, right?
Yeah.
And that's what everybody's looking for, is the fact that, now we're on this road to recovery, and we can actually get on a road to recovery because we know that there's a solution and there's an answer. And I just, I think that is what everyone really needed to hear. We know it's going to take time. We do have to be patient. And I think, number one, thank you for all the work you're doing, Marni. Thank you. Thank you for taking your time to be with us here today. Very, very informative. And hopefully we'll have you back as we're rolling out the vaccine. You can give us an update on how things are going. But thank you so much.
Yeah, thank you. Thanks for your interest. And you know how to get in touch with me and my staff, so reach out to us.
Excellent. Thank you.
All
and
right.
to all of you, thank you for joining us. Have a great rest of your day.
Thank you.